What if the current state of liver cancer treatment could be revolutionized? What if we could significantly improve the therapies available for this deadly disease? Today, we are delving into the existing landscape of liver cancer treatment, its limitations, and the urgent need for enhanced therapies. Liver cancer, specifically hepatocellular carcinoma or HCC, is the most common type of liver cancer and the fourth leading cause of cancer-related deaths worldwide. For years, the primary treatment for inoperable HCC tumors has been a drug called sorafenib. Sorafenib slows the growth of the blood vessels that feed the tumor, essentially starving it of the resources it needs to grow. This groundbreaking drug, approved by the US Food and Drug Administration in 2007, was a beacon of hope for many. However, its impact is limited, extending survival by merely a few months. It's a harsh reality that underscores the urgent need for more effective treatments. More recently, the emergence of immunotherapies, treatments that encourage the immune system to fight tumors, has shown promise. Yet these therapies are not without their challenges. When administered alone, only a fraction of HCC patients respond to these drugs. Furthermore, combining multiple immunotherapies often leads to severe and sometimes fatal side effects. In a world where cancer treatment is constantly evolving, it's clear that the current state of liver cancer treatment is still in dire need of improvement. Limited by the effectiveness of existing therapies and the side effects inherent in their use, the fight against liver cancer is a battle that still leaves many patients with few options. It's clear the need to find more effective therapies for liver cancer is a pressing issue. As we continue to explore this topic, we'll delve into the evolution of liver cancer treatment, the promise of combined therapies, and the future of this critical area of medicine. The treatment of liver cancer has evolved significantly over the years. A journey that started with groundbreaking strides in 2007, when the US Food and Drug Administration approved the use of a drug called sorafenib. This drug, a beacon of hope, worked by slowing the growth of tumor-feeding blood vessels, offering a new lease of life to many patients. However, sorafenib, like any other pioneering attempt, had its limitations. It could only extend survival by a few months. But its introduction marked the beginning of a new era in liver cancer treatment, an era of targeted therapy. As the years rolled on, we saw the emergence of immunotherapies, treatments designed to spur the immune system into action to fight tumors. These therapies presented a fresh perspective, a new way of combating this deadly disease, but they were not without their challenges. Only a fraction of patients responded to these drugs when delivered alone, and combining multiple immunotherapies increased the likelihood of serious and occasionally deadly side effects. Despite these challenges, the introduction of immunotherapies demonstrated the potential of the immune system as a powerful ally in the fight against liver cancer. It opened up a new frontier of possibilities and set the stage for further exploration and innovation in the field of liver cancer treatment. So, here we are, standing on the shoulders of these past discoveries, looking forward towards a future filled with promise. While we've made progress, the journey towards finding a definitive cure for liver cancer is far from over. In the pursuit of better treatments, researchers have started to explore the potential of combined therapies. This is where our story takes a turn towards hope and innovation. In the realm of liver cancer treatment, the scientists at UT Southwestern Medical Center are leading the way with their pioneering work on combining two powerful drugs, bavituximab and pembrolizumab. The idea behind combined therapy is simple yet revolutionary. Instead of relying on a single course of treatment, why not bring together the strengths of different therapies to create a more potent assault on cancer? It's like assembling a dream team of treatments to tackle the disease from multiple angles. Let's delve a little deeper into the science behind this. At the heart of this combined therapy is a protein known as phosphatidylserine. This fatty substance is sometimes found on the surface of cancer cells, acting as a sort of cloak that prevents immune cells from recognizing and attacking the tumor. Bavituximab, one of the drugs used in this combined therapy, has the ability to neutralize phosphatidylserine. Picture it as a weapon that strips the cancer cells of their protective cloak, leaving them exposed to the body's immune system. However, bavituximab isn't working alone in this battle. It's teamed up with pembrolizumab, an immunotherapy drug that boosts the immune system's ability to fight tumors. Together, they create a formidable duo that targets cancer cells more effectively. Yet, it's important to remember that this is still a work in progress. While the results so far are promising, more research is needed to fully understand and harness the potential of this combined therapy. This is an exciting development, one that could potentially change the landscape of liver cancer treatment. We're entering a new era in cancer treatment, one where the power of combined therapies offers a beacon of hope for patients around the world. The results of the clinical trial conducted by UT Southwestern Medical Center show promise for this new combined therapy. This study, which was published in Nature Communications, was a phase 2 clinical trial involving hepatocellular carcinoma, or HCC, patients who were treated with a combination of an antibody drug called bavituximab and an immunotherapy drug called pembrolizumab. The patients involved in the study, all of whom had cancers that could not be surgically removed, were monitored closely over an average period of 28.5 months. Throughout this period, they underwent periodic imaging to track the progress of their tumors. The results were encouraging. While previous clinical trials had shown that only about 16% of HCC patients responded to pembrolizumab alone, the response rate increased significantly when bavituximab was added to the mix. Not only did the tumors in many patients stop growing, but some even shrank. This demonstrated an increased response rate and a longer period of progression-free survival. But what about safety? After all, the goal of any treatment is not just to be effective, but to do so without causing undue harm to the patient. Well, the good news is that the combined therapy of bavituximab and pembrolizumab did not compromise patient safety. The side effects experienced by the patients were manageable and did not outweigh the benefits of the treatment. Additionally, the trial's results show the potential benefits of augmenting immunotherapy for not just liver cancer, but other forms of cancer as well. As Dr. David Sier, the study leader, noted, the study shows the promise of improving the success of cancer immunotherapies by simultaneously targeting other immunomodulating proteins. These results provide hope for patients and doctors alike as we continue our fight against liver cancer. As we look to the future, it's clear that staying informed about advancements in liver cancer treatment is more important than ever. The field of liver cancer treatment is in a state of constant evolution and innovation. We've moved from single drug treatments to groundbreaking combinations, and the journey doesn't stop here. This is a field where scientific curiosity meets medical necessity, where researchers and physicians work tirelessly to improve the odds for liver cancer patients. And this is where hope lives. In this rapidly changing landscape, the promise of gene therapy is becoming more tangible. The hurdles faced in the past are being addressed, with companies exploring alternative delivery methods to enhance safety and efficacy. The lessons learned from these experiences are invaluable, shaping the future of gene therapy and its potential role in liver cancer treatment. Additionally, the potential of hormone therapy is being re-evaluated. Once viewed with skepticism, it's now seen as a promising avenue for treatment, especially with the advent of newer hormone formulations. The future also holds promise for more combined therapies. The success of the bavituximab and pembrolizumab combination paves the way for exploring other potential pairings. The aim is to boost the effectiveness of immunotherapies, leading to better patient outcomes without compromising safety. But the key to this future isn't just in the hands of researchers and medical professionals, it's also in the hands of patients and their loved ones, staying informed, asking questions, and being active participants in their treatment journey. Research is ongoing, and with each new study, we gain a better understanding of liver cancer and how to combat it. As we continue to push the boundaries of what's possible, we bring ourselves closer to the ultimate goal, a cure for liver cancer. In the fight against liver cancer, every new development brings us one step closer to a cure.